All right, so we're on a call here with the guys from CDSF, Capital District Sport and Fitness. We got Mike and Dan, and we really just wanted to go through and just talk about some typical injuries that they might see in the gym. We have, over there they see a lot of baseball players, so we might go through some baseball-specific stuff. But we're going to focus a lot more on the shoulder and the hip today, guys, just because from a gym and baseball standpoint, that's going to be a lot of where our issues are going to be from a joint perspective. That's where we have the most degrees of freedom. So meaning our shoulder moves the most and our hip moves the most just because of the type of joint they are. So I know Dan had a question to start off with, and then honestly, everyone, what we're trying to do here is really just have a conversation about injuries, give you some information. And then if this does spur questions for you, feel free to ask questions in the comments of where this video gets posted, or reach out to us individually to go ahead and ask those questions. So Dan, go ahead. Let's start off with you.
Yeah, Pat, first off, thanks for having us. The first question we get a lot, and this, as Pat said, we work with a lot of baseball players, but this might not be just specific to baseball players, it can be anybody. We get a lot of questions about, what do I do if I'm having anterior shoulder pain? So kind of pain in the front of my shoulder. Dealing with a lot of baseball players, overhead athletes, that is something that they come to us with a lot. I'll kind of pose this to both you guys, and I'll jump in at some point as well. What are you looking for when it comes to anterior shoulder pain, and what's going to be your first, thought as to what they should be doing?
So you make a good point in that, you see baseball players, but there are, you also have people who aren't baseball players that come to the gym. So anterior shoulder pain can be different based on that, what your sport is, what a lot of the motion you're doing is, or if you're just new to the gym. If you're someone, you guys have people who aren't all sport athletes that just want to come in and work out. So from an overall general standpoint, if you're someone who hasn't done a lot of overhead work, you could potentially get pain in the front of your shoulder just from coming in and starting to do a lot of overhead shoulder work. There are a few different things that you should consider when you get pain in the front of the shoulder. It can either be your biceps tendon, which is in the front there. It can be your lats or your pecs, which those muscles come and attach into the front of that shoulder as well. Or it can actually be pain that's referred from the back side of your shoulder, referred to the front side. So those are generally the most common things that I'll see from an anterior shoulder pain perspective. And if we're going to go more specific with baseball, baseball has a higher incidence of having that biceps tendon issue because of the constant bending and straightening of the arm. So when you throw and your arm comes straight through, that biceps really has to hold on to slow your arm down, and that really pulls at the tendon at the top of your shoulder. So that can be an issue where we might have an actual biceps tendon problem, but it's not necessarily from doing bicep curls or pull-ups, where in the gym we might see more use of the biceps. A lot of times people aren't just doing a ton of heavy bicep curls. You might see that more with like a bodybuilder or something along those lines. But generally, ball sport athletes, CrossFitters, anyone like that, you're not sitting there in front of the mirror and just doing hundreds of bicep curls. So we have to look at some of the movement patterns. So in a baseball player, because of that constant hard throwing, rapid movement that we have to slow down, we can get some of that anterior pain in the shoulder, in that biceps tendon actually in there. Now, if you're not a baseball player and you're not doing a lot of bicep curls, then I would look at some of those other areas, lats, pecs, and even the backside of that shoulder, and having pain in that backside of that shoulder. So like if you guys have someone coming in who's doing where they're new to pull-ups, they're new to deadlifting, pulling off the ground with heavier weights. They're new to doing, I know you guys do a lot, which I love, a lot of the med ball throws into the wall, scoop throws, chest passes, all those kind of things to help develop power. If they're new to that can really put a lot of stress at their pecs and their lats, causing some of that tightness in the front that can sometimes be misdiagnosed as a biceps tendonitis issue.
I think we see that a lot, Pat, is this blanket diagnosis of a biceps tendonitis. And I think that's why it is important, like you said, to, okay, let's screen through what that person's doing activity wise. Are they a CrossFitter? Are they doing a lot of overhead lifting? Are they a baseball athlete? And then really try to be able to filter through, and that's where working with you helps. Exactly what structurally is going on. Is it really a biceps tendon, or there's a lot of things structurally going on through the front of the shoulder, like you said, lats and pecs and rotator cuff and brachioplexus that goes through there. So yeah, trying to filter through, right? Like what structure is causing that pain and discomfort.
Right. And I think it, which I like, how you guys approach it too, is you have to tease that out. So like I was saying before, if it is anterior shoulder pain, but you're not a baseball player and you're not doing a whole lot of biceps work, then it doesn't really make sense that your biceps would be the issue. So let's go somewhere else. Let's go to that lat, let's go to that pec, let's go to that rotator cuff, and if you're new to overhead lifting and your rotator cuff isn't stabilizing that ball in the socket, that might be the rotator cuff in the backside of that shoulder that's trying to help might be the reason for that pain in the front. And a couple of easy ways you can go through that is to take a baseball or a ball, roll on the back of that shoulder and see if you feel that pain in the front. Is it being referred? So if I'm rolling or trying to stretch my lats or my pecs or the back of my shoulder and I'm feeling that pain in the front, then you can say, okay, that's some referred pain. I'm feeling my anterior shoulder pain, but I'm rolling on the back. Let's work on that backside. But another point is, as people get to moving and doing new things, a lot of times I would expect people come to you. They're learning new exercises. They're increasing their weight. They're progressing through their exercises. That the movements aren't always perfect either. So I think where you guys come in too is cleaning up some of those movement patterns for people. So if I have someone who's new to doing pull-ups or new to doing an overhead press, and they're really leaning back and pushing and trying to use their pecs a little bit more, that can give you a pec issue and cause pain in the front of the shoulder, where I think you guys come into play too, is coming in and improving somebody's movement pattern to help with that as well.
And to go along with that, Pat, and Mike will attest to this, like, we do deal with a lot of baseball athletes. And one of the things we see in repetitive overhead throwers is that loss of upward rotation of the scap. And we see a lot of people get pain in the front of that shoulder when they have that poor ability to upwardly rotate their scap. So the serratus and their low traps aren't doing what they're supposed to do. So then all the movement at the shoulder becomes ball and socket versus good scapular upward rotation. And like you said, trying to clean up that movement and kind of teach people to feel that scap rotating upward and trying to strengthen those low traps and get the serratus working in a good way is another way that, yeah, sure, baseball athletes are going to have that same issue, but it's something to look at for people who struggle to get overhead and have pain when they do try and get overhead. Is that good movement of that scap? So I don't know if you guys want to talk a little bit about that. There's some stability issues there as well.
I think that's a good point, because you have baseball players who lose that ability because of their sport, right? So because they throw, because they do all this, they'll start losing some of that ability for the shoulder blade to move. So we know that's happening, and we need to clean that up as we go. We need to make sure their movement patterns are stay where we want them as they go through a season, as they go through training, all that. So, that it's always pretty prominent in that mind. But if you have someone who's not used to doing overhead movement, they sit at a desk all day, they're working at their desk, their arms never go up overhead. So they never use that rotation. They never use that movement to begin with. So that's someone who, when you assess them at the beginning, they might not even understand how to get into that position. Whereas a baseball player understands they might need to use their shoulder blade. We just need to reorganize the movement. Somebody who's not a baseball player, who doesn't go overhead, they might need, their exercises might start off with, wall slides or yoga push-ups or things like that are actually just trying to engage those muscles and get them to feel, or even lying on your stomach doing eyes, Y's, and T's with no weight, just trying to feel those muscles working and feel, how do I actually use my shoulder blade? So I think that's a great point. They're both needed, whether it's your baseball player or not. They're both needed. It's just what's the difficulty, I always tell people, what's the intent of your exercise? What are you trying to do with your exercise? Are you trying to learn how to move your shoulder blade? Or are you trying to reorganize your movement? Or are you trying to actually get stronger? And I think, what you bring up is, it's just, it doesn't matter whether you're a baseball player, football player, or you just got off your couch to start working out. You're going to be somewhere along that continuum to try and start creating stability in the shoulder.
And I think that's where exercise selection matters so much too. Like, let's say you have a person who just works at a desk all day, and then you have your baseball athlete. Like, both do need to be able to get overhead in a safe manner, but the exercise selection you may use may be different based on how they present. Like, Dan, I know we will talk about this a lot when we're programming, but kind of like, what is their body's natural starting position, and how do they move into that position? And if you have, and I'm sure, Pat, I know we've talked about this too, you have somebody that sits at a desk all day and is more kyphotic or is more rounded to the upper back, like, their starting point for getting overhead is going to be, at a different path than that baseball player who has really tight lats and a flatter thoracic spine. They're going to have to start at a different point, which is, knowing that starting point can kind of help you get to that end goal faster, and Pat, on your front, probably get you pain-free much quicker as well.
Right. And you brought up, Dan, earlier, moving from just the glenohumeral joint, so just the ball and socket, versus the shoulder blade. And then that movement just from the glenohumeral joint leads to an impingement.
Right.
That term to me is just a garbage term for something with your shoulder. You're having pain.
Right.
And it's not a diagnosis, in my opinion, although most people would get diagnosed with an impingement.
And Pat, how often do you see people self-diagnosing with impingement? You see that a lot?
All the time. I mean, everybody, even any pain in the top of your shoulder, front of your shoulder, people will tell you they have an impingement. And like I said, I think that is more a symptom than a diagnosis. Your pain and your impingement is a symptom of something else going on, and it's generally a poor foundation, which is poor strength around the shoulder, poor strength or movement around the shoulder blade. So, if we're talking about shoulder and injuries in the shoulder, if I had to give a general blanket statement, I would say, no matter what your shoulder injury is, start with scapular or shoulder blade stabilization exercises, your ability to move your shoulder blade. And then, Mike, I wanted to kind of go off of something you said, how important exercise selection is, but not only exercise selection, but exercise prescription. How much, how often, what should they be doing? Is it something they should be doing a lot of reps of in order to get to get that brain on board with the ability to move? Is it something that should be, more heavily weighted for more feedback? Is it something that should be closed chain, so your hands are on the wall, your hands are on the floor, or open chain, you're pulling on a band, you're pushing a weight, things like that? That's all very important in terms of the feedback that your brain gives those muscles, that your receptors hit, in order to use the proper musculature to move properly. And I know you guys are big on not only exercise selection but prescription. What is the intent of what we're trying to do? And like you said, that is a progression. You can start at step 0, or you can be at step 9 trying to get to step 10. So I think selection and prescription are very important with what's going on, and that's where you guys are the experts in that.
Yeah, I think, Dan, I'm trying to think of an example right now of, like, so we have somebody that comes in, and it's like our middle road progression that we may want to try to start them on. We may need to either add in other constraints to regress that, so they're able to feel what we want them to feel and accomplish what we want out of the exercise, or maybe it's too easy and we need to take away some constraints and kind of progress on to that. What's an example there, Dan, that we use that you could think of?
Something easy would be something that we adjust in that manner would be, I don't know, even something as simple as a dead bug, right?
There we go. I think so. Let's say our middle of the road progression, and if you've been with us or Pat, you've definitely done dead bugs before. So let's say it's a dead bug on your back, opposite arm and leg moving out. Let's say you can't keep your low back down. As much as we cue you, it's just not working. If you don't hate us and get frustrated with us, we're going to say, okay, let's add in another constraint and regress that exercise. You can accomplish what we want without, getting fed up with all our cueing.
Right.
We may move you to a wall press abs, Dan, where we add in that constraint
Yep.
of the wall. Now your hands are pushing into the wall to help you get that low back down. And now let's see if you can accomplish what we want.
And the cool part about that is it's not necessarily that you're not strong enough to do those moves.
Mm-hmm.
It's just that your brain doesn't understand them. So after, if you regress down and you put some more constraints in,
Mm-hmm.
brain can organize that movement better, and it takes less time to figure out what's going on, and you can jump back up to that progression until you actually hit a progression where you're physically not strong enough to do that. And that's kind of where our starting point would be for increasing weight, increasing resistance, things like that.
Mm-hmm.
Pretty cool. Yeah. So
I think a lot of people get discouraged sometimes because they think, oh, I'm not strong enough to do this. And it's important as, strength coaches, PTs, whoever it is to make sure that the people we're working with also understand that this might not be a strength issue. It just might be hey, let's get your nervous system fired and working the way we need it to work. Let's get your brain doing what it needs to do so that you can more efficiently do these, movement patterns.
Right. Yeah. And I think that, like I said, for me, that's the jumping off point. Movement patterns, making sure movement quality is good, making sure whatever the foundation of where your pain is at is strong and moving well. So for shoulder pain, like I was saying before, whether it's anterior, top, back, for me, it's figuring out those movement patterns, making sure you're moving well first. Then let's put strength on top of that. Then let's put more mobility on top of that if we need it. Then once you hit that mobility piece, okay, let's make sure we're moving well again with that new mobility. Let's put more strength on top of that. Then let's gain mobility. So for me, it kind of goes through this continuum of mobility or movement pattern, make sure you're moving well, stability on top of that. Then if you need to gain mobility, we can gain mobility. And then we start over. With that new mobility, make sure you're moving well. Then let's put stability back on top of that. And then if we need to gain more mobility, we do that. So it's kind of this cycle of move well, get stronger, move more, move well, get stronger, move more.
I think that's a good recipe for, like long-term success with training or even sports. Like things are going to come up. Like we can do all we can, but injuries are going to happen. Like I think if you have a model like that, Pat, it's easy to be, okay, where do I have to step back to kind of clear things up to then keep myself moving forward.
Right. And I would say the most successful athletes that I've worked with kind of adopt that pattern in terms of their accessory, their rehab work with me from a PT standpoint. They kind of adopt that pattern and stick to it. And that is where I see the most success in terms of, either higher level athletes or success in terms of getting better quicker from an injury or from a dysfunction. So
yeah, I think there's no better time than right now to show that someone as an athlete or even just a member of the gym or client of yours to have really grasped those things. Because I mean, we're all communicating, but we're not together right now. So the better we've taught those concepts, the more somebody can kind of keep themselves accountable and continue to make progress, during this time when we're all apart.
Right. Now, so, I know you guys on your Facebook page have been doing workouts and happy hours and things like that. From your standpoint, if you had someone coming in, let's say they rehab with me from a shoulder injury, an anterior shoulder injury. I worked on scapular mobility. I tell you, I worked on scapular mobility. We worked on scapular strength, trying to get mid-trap, low-trap, serratus stronger. I gave them a basic rotator cuff program. That's what they're doing for me. And they're ready to come back to you. Where would you guys typically start? Kind of walk me through where you would start and kind of how you would progress them through to get them back to pull-ups, bench pressing, like stuff like that. And it doesn't have to be super, super long, but like how would you guys take that person who just finished rehab and start reincorporating them back into their workouts?
Yeah, I think Dan, let me take it first and the transition, and then I'll pass it to you for how we would take that transition from Pat and throughout the whole process, incorporate it into their training program. But I think first, this starts, Pat, just with our communication with you. Okay, where have you been working at? How's this person been responding to treatment? What's this person like? What's their personality like, so that we get an understanding of where they're at. And then it's, incorporating exercises that you've done with them, in their initial training program. And then it's us kind of using our assessment to get a grasp of their bigger movement patterns to figure out, okay, how can we do a training program that's going to not kind of stop the rehab process. In terms of stop, I mean like a setback of re-injuring, a setback of re-experiencing pain, to keep them moving along to their sport. So I guess, Dan, let's say it's a shoulder injury. Pat has them doing their scapular work and their rotator cuff work. We assess them, and then kind of what are we looking at big movement pattern wise to make sure we want to clear to choose the right exercises for them.
Yeah, I think, depending on what the shoulder issue was, right? We want to see what their, we want to check out their range of motion. We're going to look, I know obviously we want to see their ER, IR, shoulder flexion. We want to see not only the range of motion that they have in those positions, but how do they get to those positions? So for instance, and this is one of the things about, the human body that it's just an interesting how everything's connected. Say we program a forearm wall slide, and they're going through their wall slides, and their ribs are flaring up off of their right, and they're going up. We got to make sure that their abs are working right, so that the shoulder blade has a good position to move from. So when I talk about not only their range of motion, but how do they get to those positions? That's what we're going to look at and see, okay, he has trouble going into a back to wall shoulder flexion. He has trouble getting his thumbs to the wall, but he gets his thumbs all the way to the wall if he arches his back and flares his ribs. So then it comes back to us saying, what can we do to help strengthen those, to give a better base for the scap to move on, so that eventually we can improve not just the motion, but the range of motion for that movement. So, there's a lot of things that we'll look at, based on the initial ranges of motion, that'll help us determine, the exercise selection, like we've been talking about, like what's more appropriate for somebody, a manual resistance ER at this point, or a half kneeling banded ER in the scapular plane. So so that's another thing to consider when we're going in and trying to program their exercise selection and picking their exercise prescription as well.
Right, which is great. So because it sounds more like you start off with, if I give in a program, you start off with that, and then you maybe progress that slightly and see how the rest of their body responds to what we're trying to do. And then based on that, if they can't control their rib flare with a wall slide, they might be getting a different exercise than if they can off the bat,
Or going back to what Mike was saying, we might add in a different constraint, right? So, maybe it could be any exercise, but again, don't have anyone in particular off the top of my head, but again, it could just be us adding in a different constraint. And we use a lot of half kneeling, standing, tall kneeling variations that also are going to, affect and tell us a lot about how someone's moving and where they might have some issues that we can, again, continue to address based on whatever it is they have, whatever injury it is they might have going on.
So if they have less control, you might not add as many variables, they might be more of a manual resisted thing. Whereas if they have more control, then you can add some more variables, a tall kneeling, a band, a proprio pad, a balance pad, anything like that, where you can challenge them.
And I would say, and Mike, I would say, you can stop me too if you have something to say on this as well. But for instance, one of our biggest, we have people who we've been talking about struggle to get overhead. We use the landmine press as a good way to train overhead, good scapular movement. and still add a strength element to it. And now from there, we'll either go half kneeling, tall kneeling, split stance, whatever it might be. And we can see a lot from each of those positions. If they're in a half kneeling position, they have trouble controlling their hips, and they, again, rib flare to try and push that weight up there, and then it's all ball and socket again. That might be us changing and adjusting that exercise to, again, take away one of those constraints. So maybe we go to a standing position where the biggest thing they're going to have to worry about is just keeping the ribs down and feeling that scat move.
Cool. And now, Mike, like, so generally when I send someone back to the gym, I'll give them, hey, we can do overhead. Let's stick with the shoulder. We can do, they're still on the rotator cuff and scapular program. We can start incorporating overhead lifts. How do you move from what Dan's talking about is making, continuing progressing that stability and that strength in the rotator cuff, the shoulder blade, to being comfortable with, hey, all right, now we can start pushing some weight,
Yeah, I think it heavily relies on their symptoms, and usually that's going to improve as either time passes, and with that their movement quality improves and their strength improves in these lower level exercises. And that is, it just comes back to, the exercise selection and prescription. Are we choosing exercises so it's gradual in terms of loading that tissue and putting them in positions that are lower risk versus higher risk? So like Dan said, let's say we do landmine pressing first, so you're in less shoulder flexion if that's where you get your pain. Okay, we build up strength in that. Okay, now we may go to a kettlebell overhead press, where it's a safer overhead press variation, but now we're moving into more loaded shoulder flexion. And then maybe we progress it to a dumbbell. And then, okay, after that, if their end goal is to get back to barbell overhead pressing, then probably it's moving on to a program, with that. So it's just the exercise selection along with the dosage of those exercises.
Which is what, so I always, as we talk through this, I think about, what are the recurring themes? And it's proximal to distal, meaning closer to you than further away. So we're trying to gain strength closer to your core, closer to your center. And then we move away. So, shoulder blade, then out to the shoulder proper, and then, talking about pressing up overhead and all that kind of stuff. So moving from a closer position of your body to a further away position of your body. And then, from your guys' standpoint, the thing that I keep hearing is, dosage, exercise selection and dosage, making sure we're, like I said at the beginning, what is the intent of your exercise? Making sure that all of the dosage, the selection, there's reason for it as you go. And then the third point was not just, so again, talking about the shoulder, it's not just the shoulder that works when the shoulder works. Dan mentioned the rib flare if you're rolling. Even in a dying bug, if your core is not functioning and you arch at your back, then your shoulder blade's not going to move like it should either, and you could potentially pinch at your shoulder. So it's taking a step back and looking at all of these other pieces that connect to where your symptoms are. It's not just like, oh, because I have pain in my shoulder, something must, I should just focus on my shoulder. And again, I think that's where we do a good job. You guys do a good job of let's step back. Okay, we're doing this shoulder movement, but let's step back and let's take inventory of the whole system. And with your baseball players, that's a big deal, because not only do you have shoulder issues, but a lot of times your shoulder issue or your elbow issue could be caused by your lack of rotation through your spine, or your lack of mobility in your hips, or your lack of strength in your hips. And everyone's always talked about the hips when you're pitching and when you're throwing and stuff like that, but it is true. These other parts of your body bring more to the table when you have an injury. So you've got to take into account those things as well.
Yeah, it's true. And it's even here, and it's nice though, you're sport coaches, now baseball coaches, understanding the importance of the hips and of rotation. But I feel like you still see this kind of like, these regular training programs that are all sagittal plane dominant. We're benching, we're squatting, we're deadlifting, we're cleaning. Yet you're talking about the importance of rotation and it needing to be, reflected in what you're giving these guys' bodies every week.
Right. And I actually just did a podcast, which will come out next week, about with a couple who does triathlons. And we were talking about training there, and running itself is rotational. It's just smaller than what you're used to. But like you said, everybody trains sagittal plane. No one trains rotationally. So throwing in that rotational exercise is like mind-blowing to people. They don't understand why they would need to do that. But the ability to rotate through your hips, rotate through your back, and do it effectively is like we just talked about proximal to distal. That strength that you have more towards your actual core then helps you transfer force all the way to your fingertips, all the way to your ankles, all the way to your feet. And I think that might be another topic for us to discuss is rotational exercise. What do we prescribe from a PT standpoint all the way through to a strength and conditioning standpoint? Why is it important? What is it important about it? And all that. And that stuff feeds into shoulder injuries, hip injuries, all that. So I definitely think that's another topic we can talk about.
We could probably have another hour and a half, 2 hours on just that. But
just that, yeah. So we'll let's bring it back to the shoulder. But just understanding that, I think, Mike, what you were getting at is even though it's just the shoulder, we have to look at everything else. We have to look at your rotation, your lateral movement, not just our front to back, our sagittal plane movement, because all of that is then going to transfer force into our shoulder blade, into our shoulder. And if that isn't on point, eventually, this is kind of what I tell people, micro trauma, it's just going to build up until you hit a point where, you reach out that drive-through window for your Starbucks coffee and oh, my shoulder hurts now. And that's really just the last straw. It had been building up for a while, and that was the moment that you felt it. Or everyone's done this. You reach in the back seat for a bag, or you reach in the passenger seat for a bag, and then all of a sudden my shoulder tweaks. That's built up trauma from potentially not having some of these bigger global things in check, and your shoulder is just slowly taking more of the brunt of what's going on. So,
Pat and Mike, maybe you can add to this as well. How important do you guys think it is for the general population to include some type of rotator cuff, low trap? This is kind of like a softball question, I suppose, but I feel like I don't see it enough, from people that are doing their own thing. Like, how important is it for just your everyday general population clients to be doing some type of rotator cuff stability work, strengthening work, low trap, serratus work? What do you guys think?
So go ahead. No, you go.
No, I think it's extremely important. I mean, even if their life doesn't call for throwing a baseball or being overhead constantly, like, you're still going to have actions in your life where you're going to have to be able to get overhead. And the stronger, your cuff is, or shoulder overhead, like, the less chance of that micro trauma building up because you're overtaxing those tissues in poor positions. Or you have the case where, Pat, you've probably seen this, and we've had clients that have had it. I'm just trying to think of an example of somebody in the past. Walking down the bleachers, they slip, they reach your arm out to grab, and boom, yanked and pull, and there's a labrum and a cuff. Where if they had been training, maybe it still happens, but maybe not, or maybe not to the same degree. So it matters.
Yeah, I definitely think it matters. The thing is, we were talking about before, is a lot of people don't, depending on what your situation is, a lot of people don't understand how to use those muscles or when to use those muscles. And so for what I usually see, it ends up starting off as very isolated low trap, serratus, mid trap, rotator cuff work that I want done consistently. I'm talking anywhere between 3 to 6 days a week. They're doing this program. Should only take 10 to 15 minutes to get through it, but they're doing it so that their brain gets on board with these movements. And the way I like to do it and the way I see the most success is, if you are a mover, whether you're an athlete, you work out, or you just, you work out regularly or anything like that, what I like to do is as your body and your brain gets better with those movements, we then pull back on that specific program to maybe just be doing it once a week. You should have like one day a week where we're working on some accessory, some rehab, I guess you can call it, type of movements. But if you're using them properly, you should be using those muscles like your low trap when you do a row. You should be using your rotator cuff when you do an overhead press, and maybe incorporating some pauses, some tempo work to make sure you're using them. But if I'm doing my job correctly and getting a client to learn how to use those muscles, then when they get to you and they get to the bigger, badder movements, they should be using those muscles within those movements as well. So it's not like all of a sudden, if you stop doing that isolated program, you're going to start losing strength in those muscles.
Mm-hmm.
But you want to make sure every once in a while you hit that isolated program just so that movement stays fresh in the brain. And that's kind of how I do it. But so overall, I think it's very important. And it's very important to understand that those muscles will then continue to function in your bigger exercises, like a kettlebell press overhead or a barbell press overhead or something like that.
Sure, for sure. And what would you say, and I'm going to facilitate a little bit more, it kind of goes right off of what you're saying. For people concerned that they might be doing too much of that specific work. So kind of go back to what you were saying. If people are concerned, like, well, I don't want to overdo it. What would you consider overdoing it, if there is such a thing early on?
Well, I will start off with saying you can never be too strong. I would consider overdoing it if you are, whether it's too much resistance or too many reps, you're fatiguing to the point that you're losing the technique and you're losing the ability to feel that muscle working. So generally speaking, that'll happen when people try to push through fatigue. They'll alter the way they're doing the exercise, and that is going too far. Or they'll jump, especially with some of these more isolated, if you have someone who's used to working out and they're strong and you go to some of these isolated programs, you're not going to be able to move a lot of weight with these. And so sometimes people will start off with too heavy of a resistance, whether it's a band or a dumbbell or a kettlebell, because they feel like, oh, well, I can squat 400 pounds. I should be able to do more than 5 pounds in my rotation. But they're very isolated exercises. So jumping up to too much weight too quickly, or going past the recommended number of reps after you have already felt some fatigue, those would be, that's what I would consider overdoing it. But if you're within reason with those, you can do these type of exercises, 4, 5, 6 times a week, and you shouldn't have any problems with it.
And I was doing I've been teaching, some strength camps to our clients on Facebook, and one of the things I try and emphasize right now through those strength camps is, we're not using any weights, but if you go in through those exercises that we're doing and own each position that you get into. So if you're doing shoulder exercises, own each, you want to own each position you get into. And like you said, make sure you're feeling it where it's supposed to be felt. And understand that you can get a training effect with very minimal resistance, as long as you're owning those positions and working on feeling it where it's supposed to be felt. And I think, especially in like a time like right now, is important for people to understand while they're trying to go through like either their exercise training programs or their rehab programs.
Right. Yeah, and I don't mind. That doesn't mean you can't hit fatigue and wobble a little bit. We call them the speed wobbles. You fatigue and you hit 1 or 2 more reps. That's where we're going to make our gains. And I'm okay with that, but you don't want to keep going into that just because oh, I might be able to crank out 5 or 6 more reps. No,
Right.
you hit that fatigue, and maybe you do 2 more to gain some of that training effect that you were talking about, and then that's where I would pause or move on, rest or move on to your next movement. So cool. Well, we talked mostly about the shoulder, so we'll keep it. I think we'll keep it there. We were transitioning from
for another day.
Yeah, I know. We were going to talk about a little bit about the hip, but we were transitioning from shoulder, as when Mike was talking about earlier. Rotational and getting your whole body into the movement. We were kind of transitioning down toward the hip, so we'll save that. We'll save that for another time. I think we've got a couple of other things we can talk about that came out of this in terms of rotational exercise, in terms of the hips and keeping the hips healthy. So I think those will be. I have a feeling we're going to be in isolation, social distancing for a little while. So those could be a couple of topics that we could talk about down the line.
Definitely.
Cool. All right, guys, you got anything else before we sign off?
No, I think we're good. Dan, how many walks has Rusty been on in the past few days?
A couple. He's sleeping on the couch right now, so if that gives you any indication, he's been getting his sprints in. Rusty's my dog, just so everyone's clear. I don't have any children running around my house right now. That might have a different feeling about that, but yeah, Rusty's got a sprint.
One of them came by crying. I didn't know if you guys heard it or not. So, all right, cool. Well, thanks. We'll post these up in all of our kind of social medias. Email them out. We'll probably chop them up a little bit into different pieces to isolate it. But if you do have any questions, feel free to post in the comments, email us directly. Go ahead. I'm Patrick at Suarez Physical Therapy. Mike, what are you?
Mike with Capital District Sport and Fitness.
And Dan at Capital District Sport and Fitness.
Perfect. So if you guys got any questions for us, feel free to shoot us an email or comment below. Thanks.
Thanks, guys.